Hi friends, today we are going to discuss legal aspects of medical practice, or else you can call it as medical legal issues in medical practice. Myself, Professor Suresh Badadmat, have done my MD DNB and also medical law ethics and also human rights law, PhD in law from National Law School. Currently, I'm working as a professor of psychiatry, head of telemedicine center, head of forensic psychiatry services at NIMANS, Bangalore. I do also teach in National Law School as an honorary teacher for medical law ethics program. Before I start my presentation, I would like to have a disclaimer. This presentation is basically for academic purpose only. If you would like to have any legal opinion, please do contact an advocate. This presentation is not a law themselves or not a substitute for legal profession. This presentation do not discuss any individual legislation like MTP Act, PNDT Act, TOA Act, POXO, Mental Health Care Act, or RPWD Act, and so forth. There are many acts which I am not going to discuss. Moving further, following clinical practice guideline, what we call it as CPG guidelines. See, Bolam test has its own merit, Bolito has its own merits, but now there was another CPG practice, that is clinical practice guidelines, or what we call it as standard practice guidelines, standard operating procedures. So these, whether should be accepted or not. Recently in 2019, the Supreme Court of India had come up with a landmark judgment. This case is called as Maharaja Agrasena Hospital versus Master Rishabh Sharma. This is again in 2005. A lady is now pregnant. She goes to the gynecologist for obstetric care. The doctor's name is Rama Sharma. And it is during this process, at the 32 weeks, she goes into labor. So at the 32 weeks, because of placenta previa, the Rama Sharma madam goes ahead with the what we call it as enter into LSCS, that is basically lower the cesarean section is being done. Master Rishabh is born. But Rishabh is having a severe what we call it as problem. So he is being advised by the gynecologist to take him to the nearest neonatal care. So it is in the neonatal care, the child was hardly 1.4 kgs, 1.49 kgs. He is admitted in the ICU. He has been given ventilator support, oxygen, subcutaneous injections were given, and also surfactant had been given to him. And by the end of 1 month, he has been discharged from the hospital. During the hospital claims they have done the what we call it as ROP test has been done. That is basically retinopathy of prematurity was checked. But later, subsequently, the patient, mother, and the child goes to the hospital fine. But on during December 5, the uh, mother the mother notices that the child is not responding for the visual cues. So she takes the child to the various hospital, and then they said the child has almost entered into the 4th to 5th stage of ROP, that is retinopathy of prematurity has been already developed. That is retrolentofibromatosis has been developed already. With a total retinal detachment, nothing can be done. She goes to Dr. Rama Sharma and says that, see, this has happened. Rama Sharma refers back, you have to go to Maharaja Hospital because the child was looked after by them. But unfortunately, the Maharaja Hospital, what it is mentioned in the Supreme Court decision is, there has been the medical records were not being easily shared, and the mother had to approach the Delhi Medical Council to get the medical reports, and in the medical reports they find that ROP was not done, that is basically retinopathy of prematurity was not done subsequently in the follow-up, and no further notes were seen. So she goes to the court and asks for compensation in this case. So in this discussion, the court said that there is a clinical practice guideline that whenever there is a premature child and the less birth weight, it is less than 1.5 kg, or wherever there is a premature baby along with less birth weight, you have to do retinal examination immediately after the birth, and subsequently in every follow-up you have to go on monitoring, because this is a treatable condition. Stage 1, 2, 3, 4, up to 3, 4 also to some extent is treatable. So the guidelines are very clear, but unfortunately the hospital could not demonstrate that they followed this clinical practice guideline. This did not require any kind of expert opinion, because practice guidelines are written by experts. It is already written now, you have to follow. Since they did not follow, 75 lakh was the compensation given to the mother and the child. So this is how this has been discussed. Similar to that, another case has been discussed, that is V. Krishna Kumar versus State of Tamil Nadu. This occurs in Chennai, Egmore Hospital. Again, a lady, that's Krishna Kumar's wife, goes into labor early and the premature child is born in a government hospital in Egmore. The child has been kept in the neonatal care. The child required oxygen basically, and then the child was resuscitated again. The child did well, but unfortunately, later the child was called for follow-up in the private practice. There were around 3 to 4 doctors were involved in the care of the child. None of them bothered to look into the retina. That's what the report says. Basically, the Supreme Court judgment, that is V. Krishna Kumar versus State of Tamil Nadu. And then again, the child loses the eyesight, the female child, at the age of 2008 or 2009. She goes to the court asking for compensation because she has lost eye. The doctors did not do retinal examination. If they had done the retinal examination, stage 1, 2, 3, at that time only they would have treated by laser and then she would have retained her eyesight. In this case also, the court goes for heavy compensation. Approximately, I think 1.4 crore was paid to the young girl, and the 4 doctors were made accountable along with the state of Tamil Nadu for paying compensation. So, my dear friends, please do follow clinical practice guidelines. Clinical practice guidelines of India, that's what it matters. If the guidelines have been produced by a respected body, especially in India, and have been accepted by the large part of the profession, a profession would have to strong reason for not to following guidelines. This is what is very essential. So please do follow clinical practice guideline, and if you do not want to follow, you need to have a strong reason. So that's the crux of the whole clinical practice guidelines following. So summarizing clinical practice guidelines, you have to follow those guidelines. Along with that, whenever you are discharging or a prescription you are given, please do mention your contact number in case of emergency, because now it's very clear that telemedicine practices are allowed and it is legal. So please do give in case of emergency where to do any advice, to do in-person consultation, that can be done, or even a first aid advice can be given. Please do document regular follow-up dates, when the next follow-up date is. Any side effect, please do if possible print out. Side effects, if it is there by any medicine, please do stop and report back or go to the nearest physician. Has to be documented or it is be printed, well and good. Supervised medication, please do document about weight, diet, exercise. If any investigations is required for this case, please do any investigation. For example, a child or a child premature born, please do say document that retinal examination is advised every 3 weeks or 4 weeks. That has to be done, or in the every and postnatal checkup has to be done. Investigations, I told, special precautions, anything is required, please do document. That is how the summarizing CPG has been done. Thank you very much.